Are you tired of breaking the bank on medical bills? Want to know the secret to cutting your medical expenses in half? In this video, we'll reveal the surprising strategies that rich people use to save thousands of dollars on medical bills. From negotiating with hospitals to leveraging tax-advantaged accounts, we'll dive into the little-known tips and tricks that can help you reduce your medical expenses and keep more money in your pocket. Whether you're struggling to make ends meet or just want to build wealth, this video is a must-watch. So, what are you waiting for? Click play to discover the rich people's secret to slashing medical bills in half. Today, I'm diving deep into the rich people's secrets to slashing medical bills in half. Can I uncover their tips and save some serious cash? The rising cost of healthcare is a challenge for many, but wealthy individuals have mastered strategies to significantly cut down their medical expenses. They maximize tools like health savings accounts, HSAs, which offer tax advantages and help cover medical costs. By investing in preventive care, such as regular checkups, personal trainers, and nutritionists, they avoid costly health issues down the line. Another key strategy is negotiating medical bills, often with the help of billing advocates or by directly working with healthcare providers. Many also turn to medical tourism, traveling to countries where high-quality care comes at a fraction of the price. Concierge medicine is another approach, offering personalized care that focuses on prevention and reduces overall costs. These methods aren't just for the rich. Viewers can take charge of their healthcare expenses by exploring negotiation tactics, affordable alternatives like telemedicine, or starting their own HSA. You don't have to be wealthy to manage your medical bills effectively. With the right knowledge, these strategies can work for anyone. Did you know that over 60% of personal bankruptcies in the US are tied to medical expenses? The rising cost of healthcare has become a crushing financial burden for many families, but wealthy individuals have discovered strategies to slash these costs in half. One approach they use is maximizing health savings accounts, HSAs, which provide tax advantages and help cover medical expenses. They also invest heavily in preventive care, using resources like personal trainers, nutritionists, and regular checkups to avoid costly medical conditions. Wealthy individuals are also savvy negotiators, working with billing advocates or directly with providers to reduce their bills. Some even turn to medical tourism, seeking high-quality treatments abroad at a fraction of the cost. Concierge medicine, which focuses on personalized and preventive care, is another way they manage healthcare expenses more effectively. The good news is these strategies aren't exclusive to the rich. By adopting some of these practices, anyone can take steps to better manage their medical expenses. With the right knowledge and tools, you can take control of your healthcare costs and protect your financial future. Did you know that over 60% of personal bankruptcies in the US stem from medical expenses? While many families are overwhelmed by skyrocketing costs and a lack of pricing transparency, wealthy individuals have mastered tactics to navigate and reduce their healthcare expenses significantly. One key strategy is negotiating medical bills. Wealthy individuals often work with medical billing advocates who analyze charges for errors and negotiate with providers to lower costs. Even without an advocate, they frequently contact hospitals and clinics directly, asking for itemized bills and challenging inflated or unclear charges. Many negotiate payment plans with no interest or secure discounts for paying upfront. Another advantage is their deep understanding of insurance options. Wealthy people don't just choose the cheapest premiums, they strategically invest in comprehensive plans that minimize out-of-pocket expenses for major procedures. They also explore supplemental insurance policies that cover gaps in traditional plans, such as critical illness or accident coverage. Health savings accounts, HSAs, are another powerful tool. The wealthy use HSAs not just as a way to pay for medical expenses but as a long-term investment. Contributions to these accounts are tax-deductible, grow tax-free, and can be withdrawn tax-free for qualified expenses. Some even treat HSAs as part of their retirement strategy, letting the funds grow while covering immediate healthcare needs out of pocket. By combining these approaches, bill negotiation, smart insurance planning, and effective use of HSAs, the wealthy have found ways to slash their medical expenses while maintaining access to top-quality care. The best part? These tactics aren't exclusive to the rich. With a little effort and knowledge, anyone can adopt these practices to take control of their healthcare costs. The most effective strategy wealthy individuals use to cut their medical bills in half is proactive negotiation and leveraging expert help. While most people accept medical bills at face value, the rich know that almost every bill is negotiable, and they aren't afraid to challenge the charges. Experts in medical billing advocacy highlight that as many as 80% of medical bills contain errors, from duplicate charges to unreasonably inflated costs for simple procedures. Wealthy individuals often hire professional advocates to review their bills, identify these errors, and negotiate directly with hospitals or providers for significant reductions. For example, one advocate helped a patient cut a $20,000 bill for a surgery down to $8,000 by uncovering coding mistakes and negotiating a fair cash rate. Another real-life example comes from a finance professional who negotiated a 50% discount on an MRI by offering to pay up front. Hospitals and clinics often have flexibility in pricing, especially when patients bypass insurance and pay cash, as it reduces administrative burdens for the provider. This approach is backed by experts who emphasize the importance of understanding billing codes, requesting itemized statements, and being persistent. Wealthy individuals combine this with additional strategies like asking for financial aid programs, even high-income earners can qualify in some cases, or negotiating payment plans with zero interest. The lesson? Negotiation isn't just for the boardroom, it's for your medical bills too. By adopting this strategy and being proactive, you can take control of your healthcare costs and save thousands, just like the wealthy do. John Carter, a middle-class father from Ohio, was living comfortably with his family until a serious health issue turned their world upside down. At 42, John was diagnosed with a rare autoimmune disease that required immediate and costly treatments, including hospital stays, medications, and specialist consultations. Despite having insurance, the out-of-pocket costs quickly piled up, leaving him with over $50,000 in medical debt. Initially, John and his wife felt helpless. They didn't know how to navigate the complex world of medical billing or questioned the seemingly overwhelming costs. They paid what they could, often sacrificing other essentials, and relied on credit cards to cover the rest. The financial strain caused sleepless nights and constant worry about their family's future. Everything changed when John decided to educate himself about the healthcare system. After reading an article about negotiating medical bills, he realized he wasn't alone and that others had successfully reduced their bills. He began by requesting itemized bills from the hospital and discovered multiple errors, including duplicate charges and services he never received. By questioning these charges and staying persistent with the billing department, he managed to have over $15,000 removed from his bill. John also looked into financial assistance programs and found that many hospitals offer sliding scale discounts for families in medical distress. Despite being middle class, he qualified for a program that reduced his balance by another $10,000. To tackle more complex charges, he worked with a medical billing advocate who negotiated with his insurance company to cover a procedure they initially denied. This experience completely changed John's approach to healthcare and finances. He opened a health savings account and started contributing regularly to prepare for future expenses. He built an emergency fund specifically for unexpected medical costs. He began negotiating every medical bill, learning that many charges are flexible and can be reduced with persistence. He also prioritized preventive care by focusing on regular checkups, a healthier lifestyle, and stress management to reduce the risk of future medical issues. Today, John has regained control of his finances, and his family is in a stable place again. His journey highlights the importance of being proactive, questioning charges, and exploring resources to navigate the challenges of the healthcare system. His story is a reminder that even in the face of overwhelming medical debt, knowledge and determination can lead to financial recovery. If John's story resonates with you, take the first step toward gaining control over your medical expenses. Start by reviewing your medical bills, questioning unclear charges, and exploring financial assistance programs. Advocate for yourself and don't hesitate to seek expert help when needed. Remember, you don't have to face these challenges alone. Share this story with others who might be struggling, and let's empower more people to take charge of their healthcare costs. Follow us for more strategies to save money, manage expenses, and secure a healthier financial future. Your journey to financial freedom starts today.